Hey, this is Dr. Altintas. Today I would like to give you very important information about why are we successful in combating COVID-19. As of July 2020, the survival chance for COVID patients are greater than those who were infected 4 months ago or in February 2020. First of all, we doctors now can treat the patients better. The second, I'm gonna give you 5 important reasons that we didn't know in February 2020. Okay, the first reason that we didn't know at that time that we thought the patient's deaths are due to pneumonia. Pneumonia is the lung infection. What's the lung infection? This is the trachea. Okay, this is trachea. We call it windpipe. Windpipe divides into 2 main branches. One of them goes to the right side or the right lung. The other one goes to the left side, left lung. And it divides into the bronchioles. And at the end of the bronchioles, this is the right lung. This is the left lung. We see some circles or grape shapes. We call them alveoli. These are the smallest units of the lung. It is function to change oxygen and carbon dioxide. So when you breathe in, the oxygen comes to the alveoli. It passes to, this is the bloodstream, So oxygen comes to the bloodstream. The carbon dioxide, which was produced in your body, passes to the alveoli. This is the CO2 or carbon dioxide. So when you breathe out, the carbon dioxide goes out. So we thought these patients, especially COVID-19 patients, have pneumonia. That's why they are suffering from dyspnea or less oxygen. That's why we gave these patients ventilators for their ventilation. Okay, so what is the pneumonia? Pneumonia is the infection of the alveoli. There is a mucus, it's a kind of water in the alveoli. So if you have the water in this alveoli, the oxygen cannot pass to the bloodstream. The carbon dioxide cannot pass to the alveoli. This is the pneumonia. So for the treatment of pneumonia, what do we give? We gave the patients ventilators for ventilation. But now we understand that the deaths of the patients are not due to pneumonia. That's why we don't give them ventilators. This was the main mistake at that time. Now, what do we give them? We gave them high flow oxygen. High flow oxygen. So, we understand that if there is no pneumonia, so why these patients are suffering from dyspnea or less oxygen? Because now we understand that there is a clotting of the blood. This is your blood. This is the arteries or veins. There are blood clotting. So blood cannot pass from here. That's why these patients suffer from less oxygen or they cannot take the oxygen. So now, how do we treat these patients? So we gave these patients aspirin or heparin. We call this heparin anticoagulant. So now we treat the patient better. The first reason, we don't think at all that these patients have pneumonia, and we know that they have a blood clotting. That's why we give them anticoagulant treatment. Now they feel better. The second thing that we didn't know at that time is the happy hypoxemia. Happy hypoxemia. Hypoxemia. So what is hypoxemia? If you go to the emergency room or outpatient clinic, the doctors will put a gadget on your finger that measures your blood oxygen saturation. Your blood oxygen saturation is around 96 to 97%. This number decreases with your age. When you get older, the number goes down. So it goes around 93% at the age of 70. But if this saturation decreases under the 90%, you feel breathless. We call it in medicine dyspnea. So when you go to the mountains, you feel breathless. Why? Because the oxygen saturation decreases under the 90. The problem with this patient that when their oxygen saturation decreases under the critical level, just like the 70%. Okay, this is the critical level. They cannot understand that their oxygen is very low. I'm sure all of you, or most of you, watched on the TV shows that the people who are in China, when they're walking down, they suddenly fell down. Is it just because they cannot feel their oxygen level? So this number decreases below the critical level, so their brain, their heart, their lung, their liver stays less oxygen. So that's why they fell down. So we call happy hypoxemia. Why we call them happy hypoxemia? Because you have a less oxygen, but you don't suffer from oxygen or less oxygen. That's why we call them happy hypoxemia. The third reason, or we know better, that we have the much more efficient antiviral drugs medicine. The first one is favipiravir. The second one is the remdesivir. Now, we can reach this medication, especially in Turkey, we can reach the favipiravir very easily. And we gave these patients favipiravir before they went to critical unit. That's why Turkey is very successful, especially in treating the COVID-19 patients. And I'm sure in a very near future, we're going to get the remdesivir. And remdesivir is also very efficient antiviral treatment options. So the third reason why we're better now is that we have the better antiviral treatment or medications. The fourth reason that we are successful in treating the COVID-19 patient is that we know that there's a cytokine storm. So what is the cytokine storm? Cytokines are a kind of messengers. So it communicates the it connects the defense cell of the body. So they are very useful messengers. But sometimes, just like your allergy, when an insect or when a bee bites you, you know, some patients are dying just because of the bee biting. Why? Because there's an anaphylaxis. Anaphylaxis is also just because of the cytokine storm. So sometimes it's very useful, but if your cytokine overreacts, it is not your defensive system. It is not your beneficial system. It is your harmful system. So there is a tremendous amount of cytokine in your blood. So it's not useful for your body. It is the main reason for your death or the COVID-19 patient's death. That's why for immune suppression or the suppression of the cytokine storm, we gave them now steroid treatment. So because of the steroid treatment, and we learned that the people are dying, COVID-19 patients are dying just because of the cytokine storm, we gave them steroid treatment. So now they feel much more better. The fifth and the last reason that we are now better in treating the COVID-19 patients are the position or prone position. So what is the prone position? Prone position means the lying on your belly side, not the back side. Let me show you a picture. This is the patient in intensive care unit. The patient is in a recumbent position, but in the prone position. What's the prone position? They are lying on their belly side, not the back side. Now we understand that if the patients, even if you don't treat them, if they lie on their belly side, just like this side, their oxygenation is much more better, and they can get better in a very short time. And we learned in this last month the prone position. Maybe the last reason, we call it sixth reason, there is a defensive cell in your blood. We call them white blood cells, or WBC. And we learned that these cells secrete a cytokine, which his name is alpha defensin, which is very important. And now we understand that under the blood clotting, okay, alpha defensin is responsible for the blood clotting. Now, especially last 15 days, for blood clotting or preventing alpha defensin secretion, we gave the patients colchicine. So if you give these patients colchicine, they feel much more better. So these are the list that we are now much more better. So let me give you in a nitty-gritty. The first reason is that now we learned that the patient don't suffer just on the pneumonia. They suffer because of the blood clotting. Okay, so we gave this patient aspirin or heparin, which are anticoagulant. This is the first reason. The second reason, we now learned that they have a very low oxygen level, but they cannot understand. That's why we call them happy hypoxemia or smiling patient. The third reason is that we have very powerful antiviral medication, just like favipiravir, remdesivir. The fourth one is that now we understand that our defensive system, cytokines, are not always useful. Sometimes they are very harmful for your body. That's why we prevented the cytokine storm with the immunosuppressive medication, which was used last maybe 100 years, but now we learned also very useful, which are named steroids. The fifth reason is that the prone position. So we lie down or we put them in a recumbent position, in a belly side, so patients feel much more better. The last reason, we now learned that our defense system, white blood cells, secretes a cytokine which is named alpha defensin. So if you prevent the alpha defensin secretion with the colchicine, the patients feel much more better. But yeah, okay, we are good, but we have to learn social distancing and using and putting the mask on your nose and on your mouth. Thank you for listening.